Welcome back to Autism Live. I'm thrilled because right now in the studio I have a new friend that I'm so excited to meet. Dr. Leslie Butler is here with us, and she is a pediatric dentist, which I'm impressed. Can I just say how impressed I am, because that's a pretty impressive thing. And you're coming to us from Butler Pediatric Dentistry, which is in Fullerton, I'm guessing.
Yes.
And the reason why I'm guessing that is because one of the things that we are going to talk about is Fullerton Cares and the Mardi Gras. That's all coming. We're going to talk about that. And I love to talk about Fullerton, and I love to talk about the Mardi Gras for autism. But I want to start with talking about pediatric dentistry.
Okay.
And how did you get into pediatric dentistry?
Kind of weird. I have an uncle, so he's my uncle's best friend, and he was my pediatric dentist growing up. I had zero interest in dentistry. I actually wanted to go medical. I was actually just about ready to take my entrance exams for medical school. And he's like, come work with me one summer. If you don't like it, I'll never bother you again about it. Like, I'll just drop it. And I'm like, that's so gross, working in people's mouths, like, ew. So I'm like, okay, fine, one summer. So I went, he's up in Berkeley. So I went and worked one summer, and I totally fell in love with it.
Yeah.
Like, I knew I wanted to do peds anyways, like pediatrics in the medical field, but it was just really neat to do this. And I was like, wow, this is really neat. I'm really enjoying this, the interaction with the kids and the parents and everything. And he's like, but I want you to make sure you want to do pediatrics, because it's kind of like you either love it or hate it.
It's a different thing.
Yes, completely.
Yeah.
So he let me go work in an ortho office. I worked in a dental lab. I worked general dentistry. So as an assistant, I did that.
Right.
And I just totally fell in love with peds. And then so I ended up taking the entrance exam, doing well, and I got into Loma Linda and just kind of went from there. And then I went to residency for pediatrics, and here I am.
And so you've been doing this for a while.
Let's see here. I've been practicing for about 10 years now.
Wow.
Yeah, so I know.
Well, you don't look like it. You don't look like it. And I got to say, just you have such a comforting presence. You came in, and the dentist thing can be a nerve-wracking thing for anybody, right? But I can see why the kids would just love you and trust you, and you're an open person, and so I can see why they would.
I think I'm a big kid. I just like to have fun.
Well, and what a wonderful thing to have in a pediatric dentist, because a lot of people that are watching, I'm sure, when you have a child who's on the autism spectrum, I mean, when you take any child to the dentist, there's some anxiety from the parent, which I'm sure the kids read. But when it's a child on the spectrum, it's that much more nerve-wracking.
A lot harder and nerve-wracking and stressful. The parents are, especially the first-time parents that come to our office, since they've never experienced our office, they come in and their stress levels are through the roof because they don't know what to expect. They're just expecting the absolute worst. Yes. And it's, and we're just there to try to make it as easy as possible for them and for their child.
So which came first, the chicken or the egg? Did you start treating kids that were on the spectrum first, or did you meet Fullerton Cares first?
This is a very interesting story. In residency, you kind of work with a particular group. So I worked with hematology and oncology. So I worked with patients with cancer and things like that. And I loved it. And so when I came out of residency, I knew I wanted to work with special needs kids in some dynamic. But I just didn't know how to get my footing there. I didn't have hospital privileges at the Children's Hospital yet or anything, so I didn't know how to get my foot in the door. And then in my door 4 years ago walks Larry Hauser with his son Boyd. I had not been familiar with autism. I mean, obviously I knew it existed, but I wasn't schooled on it. I didn't understand it. I didn't know what these families were going through, what these children were struggling with. And so here comes Boyd and Larry, and he's like, he's never really done that well. Let's just see how this works. I think he'd been to multiple offices before us, and I'm like, all right, so let's just see. I grew up with a learning disability, so I had trouble all through school through second grade. So I'd gone through multiple therapies and biofeedback all the way actually through residency. So I was like, okay, I'm just gonna work with him and try to do some techniques that I was taught and that I've had to use in my life, and then just other behavior management techniques like show, tell, do, working with animals, taking time, counting numbers, just all these different things where I didn't have any background in any of this. And he ended up doing really well. It took a little bit longer, but we were like, okay. And then Larry was like, wow, that's like the best he's ever done. And I'm like, really? Okay. And something that we now offer routinely, but at that time I was like, well, why don't we try maybe having them come back more frequently to acclimate them to the office and kind of desensitize them. Now we actually call them friendly visits. And we will offer them to any family with a child with sensory issues or high anxiety. And they're no charge visits, and they actually come, and it lets them they get an assistant for 30 minutes one-on-one. And if that just means they're like hanging out, they play in the games, they walk through a door, like they make progress in the office. Right. The whole point is to make progress. So Boyd did that like a couple of times, and then after that it was like he never needed it again.
Wow.
And he just did better and better. His appointment times got shorter and shorter. He's done sealants, like everything. He's down to a normal 30-minute appointment like every other child. He's in what we call an open bay, where he's in a room with other kids. He just did his first filling. I got permission from Dad, so he told me I could say that.
Oh, that's wonderful.
But he just did it, and he did fantastic, and we just did his number counting and just took time and showing him everything, and he's just done amazing. And that was actually my first exposure to autism.
Wow.
Which obviously led to Fullerton Cares from Larry. He kind of said, "You're really good at this," and I was like, okay, like I was like, I don't know what I'm doing. He goes, would you like to, like, I want to help you. You need to be a part of this community. And I'm like, I would love to be a part of this community. I loved working with him. And then, so I started working with Fullerton Cares, and so I love supporting everything they do. I'm always the first, I'm like, yes, I'll sponsor whatever you do. I love it. This is going to be our 4th year at their event, their Mardi Gras event.
Yes.
But so Larry's just been our big cheerleader, and he's just been amazing. But that was how I was introduced to this world, and it wasn't something I was searching for. It found me.
What an amazing introduction to have Larry Hauser be your introduction to this world.
He literally just walked in. It was like, boom.
Yeah. And I understand that Larry's watching, and Larry, you know we love you. And there's something about Larry, that Larry is amazing, but Larry is an amazing magnet, because I have seen that he attracts amazing people.
He has a wonderful personality, and just kind of like, yes.
But clearly you do too. And so there's Larry, and he magnetized you, as he does with a whole bunch of wonderful people that become Fullerton Cares. And I think it's part and parcel of why this event, the Mardi Gras for Autism, is so amazing.
Yes.
There is something about it, you guys, that it is a community of amazing people coming together. Where else do you go to an event that the pediatric dentist is there supporting and this excited than Fullerton?
We love it. Our team members actually fight to go, like who gets to go and work the event.
I love it.
And it's just so much fun, because now so many of our patients are there. So like we had one patient this week, and actually it was the best visit he's ever had, and the mom was so excited. She goes, he's actually performing on stage this weekend, and she goes, we can't wait to see you. And he's like, I'll see you there, Dr. Butler. And it's just really fun, because we get to see so many of our patients, but we just get to interact with so many other wonderful organizations, and we're all there for the same reason and the same purpose and the same goal. And I work in another office sometimes, and I talk to parents all the time there, and they're like, I've never even heard of these things. And I was like, oh my gosh, you have to go. So I'm always like writing things down and giving them to parents. But this event has just been amazing. It's just so much fun. My family comes, my husband comes, my kids come. They have a blast all day with the face painting, the sensory zone, the big garden they set up. It's really fun. My daughter might actually get involved with all the blow-up stuff this year. She's just turned 5, so we're finally getting to that age of like,
One of my favorite, I mean, there's so many things I love about the Mardi Gras for Autism, but I love getting there in the morning and setting up and seeing all the volunteers.
Oh my gosh, yes,
and
the
all
volunteers.
The teenagers and the young adults who are there to volunteer and work together as a group it's really an indicator of how special, see, I'm going to get emotional, but how special, because if you can get teens to show up and say, I want to be a part of this, you know that you're onto something really incredible, and they show up by the droves.
Oh, the volunteer, I mean, I haven't volunteered because I always work the event, but the meetings they have and the groups, and it's like they have just the group that's in charge of the volunteers is so big, and it definitely takes like a village to put this on, and it's such an amazing group of people.
But before we were on, we were talking about it, and you said it's a party. It's a big party. But I love that it's a party that at the center of it is this idea of a community that's helping children on the spectrum.
Yeah.
And I love that the focus of the party is on the kids.
Yes. Everything's about the kids.
And them having fun. That each one of the booths has activities.
That's what I was actually just going to say.
So
one of my favorite things is how every booth has to have an activity for a child with sensory issues or autism. So our booth, we have all these like really fun stuffed animals with a bunch of big old giant toothbrushes, and the kids get to brush the teeth and things like that and floss. But every booth has a different interaction and a different game, and it's great. And even like siblings, like if the kids don't even have sensory issues or anything, this is still an amazing event.
Oh yeah.
And like there's so many other siblings there and things like that, but I love how every booth has an interaction that they get to do with the kids. It's so much fun. And then we actually kind of like in the beginning, you'll go around the booth and you're kind of playing the games, and at the end when everything's kind of closing down, everyone kind of walks around and you play. But it's really neat and it's fun, and it's just been an amazing event to be a part of. And I'm lucky to have been able to be invited to be a part of it. And now that it's our 4th year.
But you know what? As a community, though, I mean, I will say that I'm always talking to parents and parents from around the world, and we talk about what do you need, getting in place what you need. And we always say to people, you know, get yourself some sort of global support so that you can talk to parents that maybe you're talking to a parent in Ireland who's got a child that's like yours and you don't feel alone, right? But that you still have to have something that's a local support.
100%.
And one of the things we say is because eventually your child's going to need a haircut and they're going to need to go to the dentist, and there's always, you know, like a dentist you shouldn't go to, but a dentist you should go to, and you're not going to know that unless you're a part of that local support.
That community.
But even then, it's a little bit of a hit and miss finding the dentist. And so the fact, I gotta say, you consider yourself lucky that you're at the event, but I gotta say kudos, Larry, for thinking ahead and having a dentist and pulling the dentist to be in, because everybody needs to know who's the dentist, and clearly you're the dentist to go to.
We try. I mean, like I said, we absolutely love what we do, and we've changed, we've set up a whole protocol for our patients, and we've just done a huge expansion of our practice that's literally was built for our patients with sensory issues. And we have an actual sensory room. And we actually have sensory panels everywhere. We have one in our waiting room. It's been an amazing progress. And I'm like, I blame Larry for all this. Like, this is your fault that I'm doing all this. I was able to work with a professor who I happen to go to dental school with. He's in charge of the Autism Dental Clinic up at University of Washington. He built it with the university, and we graduated together. So he worked with me on developing this. I also worked with Summer Dobbs, and she came in and we walked through everything, and we made the room soundproof. It can be completely blacked out. Wow. There's light machines, sound machines. There's aromatherapy, sensory panels on the wall. There's like the weighted blankets and toys and things that can be heated and cooled, and baskets of the sensory toys that they can play with and fidget with.
Wow.
But everything, like the response has been amazing. These kids who haven't done so well, just because the parents have made, like yesterday, Mom made a comment that she felt like the open bay was like a jungle gym. You know, there was too much free reign.
Okay.
So we moved him into this room yesterday and closed the door. And he actually did everything, because we actually have a handheld x-ray machine that looks like a Buzz Lightyear gun.
Right.
And so it's not intimidating or anything, and everything in that room is soundproof, even our cleaning tools. We have a cleaning instrument that handpiece, and it's silent. So we can start the kids there, and then we can progress them to like the next room, then to the next room, and then eventually to the open bay with the rest of the kids. And it's just really great.
I have chills. I mean, a dentist who's got a sensory room, but it's pediatric, so how old do you go up to?
I actually have special needs adults as well.
Okay.
So I have a few adults with autism, like one that I've been treating for over 10 years now. He's like 19, but I have like a 28-year-old. I have a 56-year-old. I have a 67-year-old. Healthy patients, my healthiest is 25. She doesn't want to leave. She has 2 younger brothers. One is on the spectrum. So so I told her, I was like, you're welcome to kind of stay. And I said, if you have big kid problems, then you have to leave. But we see the youngest patient I've ever had was 3 days old, straight from the hospital.
Wow.
And then my oldest patient was 67.
What does a pediatric dentist do with a 3-day-old baby? There's no teeth, right?
Actually, he was born with a tooth.
Wow.
So yeah, so the
That's
pediatrician.
unusual, huh?
It is actually. I used to see it a lot at Loma Linda, but it is actually it is very rare. So the pediatrician knew me personally, so she called my cell phone and was like, "Can they come down?" So they literally like checked out of the hospital and drove down to the office.
And do you keep that tooth?
Well, in his case, it was really floppy and soft and bending, so we did take it out.
Yeah.
But I usually give the parents an option.
Okay.
But in his case, we took it out. Usually when I was at Loma Linda, we would remove them as well. But no, so that was my youngest. I do a lot of frenectomies as well on infants. So
what's a frenectomy?
when they have the little tongue ties and the little lip ties for nursing issues.
Yes.
So lactation consultants will send them to me, and I use a laser to release the tongues and the lips so the kids can feed better. So
this is a fascinating thing.
So dentistry is not just about teeth.
It is. Well, I'm
there's other
learning
stuff
about
too.
that.
Yeah.
Clearly, I need to be educated. So, let's back up for just a second. For people who now have heard this and they want to come to you as a dentist, are you accepting new patients?
Oh yeah. We always take new patients, and I have 2 wonderful associates that work with me as well. Dr. Gloria is there today. Whenever a new patient calls the office, we always ask if there's anything in particular that we should know about your child before they come. And if a parent says that they have sensory issues or they have autism, we now have a 1 to 2 page information, like a questionnaire that we send, and it allows us to get to know the child before they come. So it lets us know what their triggers are, what sets them off, if they've been to the dentist before, what have they been able to get done, have they ever had to be sedated for dentistry. So it just lets us know. So when that family comes in, say the child has a sound issue, like that's a trigger for them. We actually turn off all the radios, like stereo system, we turn down all the TVs. If a child has a lighting issue, we actually turn out half of the lights. If a parent feels that a child's gonna be better with no one there, we actually will do quiet time visits where there's nobody in the office. So we try to adapt, but yes, we do take new patients. And like I said, we just really love what we do, and it's great.
And do you take a lot of different types of insurance, or they should call to see?
Call to see. We are a network with 13 insurances, I believe. I'm not really the person to ask, but I know there are people. Everyone in my office can answer those questions, but I know we're a network with 13 PPO insurances. Okay. So so parents can call and they can ask, and they'll be happy to give them all the information.
And how do we get in? What is there a website that we go to?
We're all over social media. So we're actually on Facebook.
I love that.
We're very active on Facebook. We have a website.
So the Facebook, though, is under Butler Pediatric Dentistry? Okay.
Yep. And our website there's nothing special about the name, just butlerpediatricdentistry.com.
Okay.
And then you can always call the office and talk to people if you ever need to reach out.
Okay.
Yeah.
And then going back to Fullerton Cares and the Mardi Gras, so you will be there.
Yes.
And the date is April 7th, so it's a week from Saturday.
Yeah.
And the hours on it, I'm not sure if
We're there very early. I think the hours are 11 to 4, I think.
Put the poster back up for us, Samantha, so we can cheat. There it is, 11 to 4.
11 to 4, yeah.
Larry's cringing that I didn't remember. It's okay, Larry, we got it. And so there's the poster for you guys. And if you want more information about it, you can go to fullertoncares.com. But they also have a Facebook site as well.
Yes, yeah, Fullerton Cares has a fantastic Facebook.
And I have to say, you know, every event that we go to has a different flavor to it, but the particular flavor of Fullerton Cares, if you want to feel like you are in a warm cocoon of people that care, and that it's not about going to an autism community event. It's about going to a community event where you will see true inclusion. That's really what it's about.
Yes.
And I, you know, normally I go to an autism event and people come up to the booth and, you know, and we have a conversation, and at some point I will say, do you have a child that's on the autism spectrum? And usually at an autism event you will get a yes.
Yes. Yeah.
At Fullerton Cares, at the Mardi Gras, it's more likely that they will say, no, but we love someone who's on the autism spectrum, which just makes me want to throw my arms over my head and go, yay, because it is a model for the world. It is where we all need to get. If you have if you don't live in Fullerton and you live far away from Fullerton, but you've been thinking about coming to California because you want to go to Disneyland, and Disneyland is just around the corner from Fullerton Cares. So what you should do is come at that time and come and see this event. If you want to get a plan for your community and get it together and have what these folks have, you need to see it.
It's really fantastic. It's takes up the entire downtown train station parking lot. It's some of the things that they've had have just been so much fun and entertaining, and like I said, even adults have fun, and all the restaurants are open, so you can get all the food, and it's a blast.
Yeah.
It really is, like I said, it really is a party all day.
It really is. Yeah. And my son has been to enough autism events that he could care less ever to go to one again. But if he has to miss the Fullerton Cares Mardi Gras, he is bummed for the entire year that he can't be there.
It's really fun.
And he's going this time, so he's excited about that. And it's a really good time. You will thoroughly enjoy it. We will be there. And Dr. Leslie Butler will be there as well. Thank you so much for being here.